These college students were thinking of taking a camping trip.
Yeah, so I heard Houston Woods like a great place to go camping.
Now, howdy, y'all.
Hello.
How you guys doing?
Good, I guess.
Where you guys heading?
Houston Woods.
The woods. Oh, have you heard of the Hantavirus?
The what?
The Hantavirus.
The
Hanta.
Hantavirus?
Hantavirus.
No,
Well, you know what it is?
not really.
Are you laughing, boy? You won't be laughing.
Sorry.
You won't be laughing. Let me
Okay.
show y'all. Let me show y'all what to look for right quick for the Hantavirus.
Okay.
We've hired our hantavirus expert, Country Joe, to help inform the students of the dangers of the hantavirus.
This right here is rodent feces. You see, it's a straight shot to the hantavirus. You see the little mouse poopings here? They'll get you right to the disease. You see, rodent urine is another straight shot to the hantavirus. You see, us country folk, though, we got immunity. So lately I've been drinking rodent urine to try to get more immune. Gotta stay safe out there.
Hantavirus is most commonly spread by deer mice, rice rats, and cotton rats in rural areas. When the feces is swept, the virus becomes airborne. Symptoms may occur within 1 to 5 weeks of exposure. Country Joe is a survivor of this horrible disease and shared with us his experience.
So now I suppose I'll let you know what can happen. What can happen to you is if you don't obey what I'm saying. You need to stay away from that rat urine. Stay away from that rat fishes. Or guess what's gonna happen? You're gonna get headaches. You're gonna get headaches, you're gonna get chills. You're gonna get fevers. You're gonna get nausea, blurred vision, a rash, inflammation. You don't want none of this, man. You know, I had the hantavirus. It put me out for weeks. I felt like I had the flu, but nah. Hantavirus from them rodents.
America's first contact with the disease was during the Korean War. In the U.S., 95% of the hantavirus cases occur west of the Mississippi River.
So, you boys afraid to go out in them Houston woods?
I don't really want to go anymore.
I don't want you boys to be afraid. Because, you know, I grew up in Houston, Texas. That's where you gotta be afraid, west of the Mississippi part of Texas. Yeah, and my sister, Betty, you know, she got a different strain of the hantavirus, and she had the hemorrhagic fever with renal syndrome. Betty died at the age of 13.
Hantavirus can be difficult to diagnose because of its flu-like symptoms. A complete blood count and an oxygen saturation test can be used to determine if the hantavirus is to blame. If you are diagnosed with the hantavirus, an intubation or oxygen therapy may be used to treat your symptoms. If you contract a strain with HFRS, later symptoms could include low blood pressure, acute shock, and vascular leakage. Mary Sue found out when she went to the doctor and they did a serologic test. The hantavirus antigen can be found in the tissue, and the RNA sequence can be found in both the blood and tissue. Treatment includes management of fluids, electrolytes, oxygen, and blood pressure. They also do this to prevent the patient from getting any secondary infections.
So just remember, boys, when you go out in those woods, you need to set out an area, a nice, clean area. You gotta set up some traps to get the rodents, all right? And stay away from the rat urine and the rat feces, all right? And you'll be just fine. You'll be just fine. And stay east of the Mississippi.
Thanks, Country Joe!
No problem. Just doing my job.
This has been a CDC PSA.